Are you suffering from dead butt syndrome and getting a lot of pain in your glutes and down the side of your thighs? Well, it's not a dead butt, but it is from probably sitting too much. What is known as is gluteal tendinopathy, which can lead to trochanteric bursitis. Holy smokes, medical jargon! We're going to get into what all that means and what you can do. Gluteal tendinopathy is a weakness of the glute medius muscle. Here's a look at the gluteus medius muscle that we're talking about, depicted by number 21 in the diagram. This muscle is to the back and to the side of the body, attaching from the top of the hip down to the femur. What happens is this muscle is weakened and it's not helping to stabilize the hip and the femur as well as it usually does, oftentimes from in-use, inactivity, or poor biomechanics. Due to the weakness of the glute med, the knee has a more tendency to go inwards, increasing the stretch of the tendon of the glute med. That tendon is over the trochanteric bursa. Now, when there's the knee coming inwards more, it actually increases the strain over that bursa and can kind of cause an inflammation of that bursa, causing bursitis. Now, for gluteal tendinopathy, that muscle in the glute can also become weakened. And when muscles are weakened, what they actually do is they try to squeeze and hold on tighter. So it's not uncommon for you to actually have pain right in the buttock from that muscle just squeezing and trying to hold tighter to compensate for its weakness. The primary function of this muscle is to bring your leg out to the side, also known as hip abduction, shown above. The second function of this muscle is to stabilize the pelvis, preventing your hips from dropping when you're standing on one leg. As you can see, it's the left side that's supporting the right side from dropping. Here's a look at the knee valgus we're talking about. And what's happening here is with the weak glute med is the knee is actually coming inwards. There's three major things that you need to do to improve your gluteal tendinopathy. The first thing is avoid aggravating activities or positions. For example, sitting cross-legged for long periods of time, sitting for long periods of time, laying on the affected side, or doing anything with a lot of force or speed that's causing a high level of pain. The second thing is being aware of your biomechanics. So making sure that your knee and your hip and your ankle are always in a good alignment. You don't want to be having the knee coming into that valgus that we've discussed before. The third thing is strengthening of the glute med muscles and gradual return to activities that were aggravating. To begin this first exercise, place your hands on your waist and bring your legs shoulder width apart. What you're going to do is tilt side to side, or waddle if you will. Now the goal here is to increase the strength of the glute med muscle in single leg standing. After a few seconds, you should start to feel a burn. You're not trying to bring the band any further out, you're just trying to maintain the distance the entire time. This is helping to increase the stability of the leg when you're standing on, well, one leg. The goal is to work up to 3 sets of 45 seconds. The next exercise is a side plank, working on the lateral stability of the core and the glute muscles. Beginning at your knees is easier, then progressing to your toes. For an even more difficult challenge, you can start to incorporate active hip abduction of the top leg. Now you're working all three components, core and both glute muscles. Again, 3 sets of 45 seconds. The last exercise here is the offset sit to stand. Have your heels aligned to the toes of your back foot. What you're going to do is you're going to keep your knees straight while you sit back down. You really want to make sure that your knee isn't coming inwards, as you can see here. The idea here is to incorporate the glute med strength functionally so you can control your knees in that good alignment, improving the strength of the whole lower chain.